Okay, good morning, everyone. I want to thank everyone for joining us today. This media briefing is being streamed live on our Rock County Public Health Department Facebook page. After the media briefing, this recording will also be available on our YouTube channel as well as our Facebook page. We'll be hearing some COVID-19 updates from the Rock County Public Health Department, and then we'll be opening it up to the media for some questions. So today, joining me, I have Kelsey Cordova, Public Health Supervisor, Matt Wesson, Environmental Health Supervisor, Nick Zupan, Epidemiologist, and I am Jessica Turner, Communications Specialist. So I'm going to turn it over now to Nick for some data updates.
Thanks, Jessica. As always, we're going to start off with just the numbers that we're seeing and some of the trends that we've seen over the past week. So as of yesterday afternoon, we've had 14,431 Rock County residents test positive for COVID-19. So this is an increase over the past week of just under 100 new cases. We're averaging about 14 new cases per day. And, 100 isn't no cases, but it's certainly a lot better than we have been seeing over the past few months. So we continue to see downward trends in our case activity locally. There are about 175 active cases based on what we know about who has recovered from their illness. And there have been 159 deaths due to COVID-19. Yesterday, we had 5 patients in the hospital getting care for COVID-19, and this number thankfully continues to drop. So we are averaging about 9 patients in the hospital per day over the past couple weeks, but the numbers are continuing to fall, which is great news. Based on our vaccination numbers, we are now over 27,000 Rock County residents who have gotten that first dose of the vaccine. So this is over 16% of our total population. And we've had over 16,000 individuals get that second dose and have full protection from the vaccination. So this is about 10% of our total population. When we look at the individuals who are 65 and older, we've had more than half of those people have their first dose of the vaccine. So this is about 15,600 65 and older individuals who've gotten that first dose, and more than a quarter of those individuals have gotten their second dose. So we're looking at about 7,700 individuals who are 65 and older who've gotten the second dose of the vaccine. Those numbers are showing great progress, and I'm very optimistic about the trends that I'm seeing, both in terms of the case activity decreases and the vaccination uptake and increases. We're seeing fewer people with severe illness, so things are looking good right now from the data side of things. So with that, I'm going to turn it back over to Jessica.
Thanks, Nick. Sorry about that. I had trouble getting back to my unmute button. I will now give it over to Kelsey, and she's going to be giving some additional updates.
On March 1st, even more Wisconsinites became eligible to receive the COVID-19 vaccine. Education and childcare staff, individuals enrolled in Medicaid long-term care programs, some public-facing essential workers such as 911 operators, utility and communication infrastructure workers, and public transit workers who have close contact with the public, and food supply chain workers. In addition, non-frontline healthcare personnel and the faculty staff, or the facility staff, and residents living in congregate living settings are now eligible. It's important to note that due to vaccine supply, groups will receive the vaccine in priority order, and it will take time to get to everyone who is eligible for their vaccine. Once you're eligible for vaccination, you remain eligible as new groups are added, which means that frontline healthcare personnel, residents and staff in nursing homes and long-term care facilities, first responders, including police and fire, and those over age 65 will remain eligible and will be prioritized of seeking a vaccination. We encourage all those who are eligible for the vaccine in Rock County to register on the Rock County Public Health Department website. Filling out the registration form provides your information to many local vaccinators who will contact you when they have appointments available. In addition to the registration forms on the Rock County Public Health Department website, the Wisconsin Department of Health Services will soon launch their statewide Wisconsin COVID-19 vaccine registry. Filling out that registration form lets state-sponsored clinics, like the one out at Blackhawk Technical College, know that you are eligible and interested in a vaccine appointment. Clinics using that registry system will then reach out to you as appointments become available. On February 27th, the U.S. Food and Drug Administration issued an emergency use authorization for the Johnson & Johnson vaccine for the prevention of coronavirus disease. The Johnson & Johnson vaccine is the third to receive emergency authorization from the FDA, following Moderna and Pfizer. The new vaccine has been proven safe and effective. While the Pfizer and Moderna vaccines perform somewhat better in clinical trials, the Johnson & Johnson vaccine has other advantages. It requires only one shot and doesn't need to be kept at certain temperatures to maintain integrity, and studies show that it may curb the spread of the virus. And it's really important to note that all three vaccines are nearly 100% effective at preventing severe disease from coronavirus and death due to coronavirus. We strongly encourage everyone to get vaccinated and support all three of these vaccine options equally. Turn it back over to you, Jessica.
Thanks, Kelsey. Now we will have Matt Wesson giving us some information about our recent changes to the Rock County reopening plan.
Yes, as most people are aware, we on March 2nd, Tuesday, we shifted our reopening plan to phase 2. The main difference was that we increased the capacity limit recommendation to 50% in most facilities and situations, as opposed to 25% that it was previously. We certainly feel strongly about this, based on our data metrics and the improvements we've had over the last several weeks. We certainly consulted with a lot of our community partners, and most of them were in agreement with this. So we'll continue to monitor the metrics. In the near future, we'll certainly look at moving on to phase 3, once the data shows that, and hopefully that's in the near future. But we caution everybody to remain vigilant, with respect to COVID safety practices, social distancing, mask wearing, especially staying home when you're sick, getting tested when necessary. Great,
Thanks, Matt. So we will now open it up to questions from the media. We ask that you raise your hand if you have a question. We'll allow you to unmute and ask your question. If you're joining us by phone, *9 will raise your hand and *6 will unmute and mute your phone. We will go ahead and get started with Ashley McCallum from Janesville Gazette.
Hi, everyone. My first question today is if you know whether or not Rock County will receive Johnson & Johnson vaccine. If so, when will that be received and how will it be used locally?
So I don't have a timeline exactly for the Johnson & Johnson delivery, but we do anticipate it being included in the mix of vaccine that local providers are allocated from the state. It's just another resource, another tool in our toolbox to help expand vaccine supply here locally. The state has mentioned that they have sort of earmarked or set aside some Johnson & Johnson vaccine for educators around the state of Wisconsin.
Great, thank you, Ashley. And actually, Ashley, it looks like you are the only media person that we have on today. So if you have any other questions, go ahead.
Sure. I will not turn down the opportunity. So from talking to some local providers, I've heard that a few are sticking right now to vaccinating the 65 and older population. So I wanted to know if you're aware of any Rock County providers who are starting to also work on vaccinating our educators and child care workers, which you mentioned are kind of the top priority within, the eligibility group that is newly eligible.
Yeah, so because the state is sort of setting aside vaccine from the federal level for educators and childcare providers, at this time, we're awaiting those deliveries in order to begin vaccinating the educators and childcare providers. So at this time, Most local providers and statewide providers are continuing to prioritize those that are 65 years and older and those frontline healthcare workers. As Nick's data mentioned, we still have a good chunk of those eligible for the vaccine in Rock County that are still looking for it. So we're going to continue vaccinating them as long as we can identify them.
Thanks, Kelsey. If you have another question, Ashley, go ahead.
Can you hear me? Am I still muted?
Oh, I can hear you.
Okay. So we learned this week that Hormel and Beloit has started a program to vaccine its workers through a partnership with Beloit Community Health System. I was wondering if this is a model that you think other local employers should consider for vaccinating their workforces when eligible, and do you intend to partner with any employers to do something similar to this down the road?
We would certainly encourage all employers and large business facilities to reach out to local healthcare systems, maybe those that they're affiliated with through insurance programs, just to find out what sort of partnerships can be developed. It's a great idea and a great way to bring the vaccine to people or vaccinate large groups of people through these partnerships. So we would certainly encourage others to be reaching out to local providers to see what kind of connections can be made. The Rock County Public Health Department is no exception. Vaccine supply obviously is a very limiting factor, as is our capacity to provide vaccinations. We're still very busy, even as cases are decreasing in Rock County. We're still very busy with contact tracing and disease investigation. So vaccine supply in combination with our capacity will impact our ability to make those connections as well, but it's certainly an opportunity.
Thanks, Kelsey. Do you have another question, Ashley?
Yeah, in regards to moving on to phase 2 this week, I think this was something that was really exciting for many folks, and we've seen some other health departments in the state and across the country really kind of make similar changes. I was wondering, kind of with the partnership, or not partnership, but relation of the move to phase 2, as well as vaccines kind of coming in and springtime coming, which is when I think a lot of people start to get really excited about new opportunities. Is there any concerns about, I guess, opening up, too quickly, causing another spike? And I guess what plans do you have in place if you start seeing data trend, in a negative direction again?
Yeah, that's certainly a concern. Certainly, we open things up, based on a number of factors. Things are definitely trending in the right directions in a lot of ways. But as we have been through this whole pandemic, we'll keep a close eye on the metrics, keep a close eye on the numbers, and if things start to trend the other way, then we'll certainly entertain maybe going back to phase 1 or kind of tightening the restrictions a little bit.
Thanks, Matt. Any other questions, Ashley? Okay, Ashley, if you don't have any more questions, then I think we can end this media briefing for today. Thank you so much for your participation, Ashley. And if anyone else from the media is interested in participating on these weekly media briefings, we encourage you to do so. We do have information that we can send you to participate. So if you're interested, send an email to media.publichealth@co.rock.wi.us, and we will get you that information. I want to thank everybody who's been watching us on our Facebook live stream, and remember that these recordings are available on Facebook and our YouTube channels once this briefing is concluded. So I want to just remind everybody to continue with the prevention measures, even though we are opening up into phase 2 and we do have the vaccine available. We do still need to remain vigilant while we try and vaccinate as many people as we can, as quickly as we can. So remember to continue wearing your masks, social distance, wash your hands, and avoid large gatherings. Thank you, everyone. Be well and be safe.